What is a hemoglobin A1c HbA1c test? A hemoglobin A1c HbA1c test is a blood test that shows what your average blood sugar glucose level was over the past 2 to 3 months. Glucose is a type of sugar in your blood that comes from the foods you eat. Your cells use glucose for energy. A hormone called insulin helps glucose get into your cells. If you have diabetes, your body doesn't make enough insulin, or your cells don't use it well. As a result, glucose can't get into your cells, so your blood sugar levels increase. Glucose in your blood sticks to hemoglobin, a protein in your red blood cells. As your blood glucose levels increase, more of your hemoglobin will be coated with glucose. An A1c test measures the percentage of your red blood cells that have glucose-coated hemoglobin. An A1c test can show your average glucose level for the past 3 months because glucose sticks to hemoglobin for as long as the red blood cells are alive. Red blood cells live about 3 months. High A1c levels are a sign of high blood glucose from diabetes. Diabetes can cause serious health problems, including heart disease, kidney disease, and nerve damage. But with treatment and lifestyle changes, you can control your blood glucose levels. Other names: HbA1c, A1c, glycohemoglobin, glycated hemoglobin, glycosylated hemoglobin. What is it used for? An A1c test may be used to screen for or diagnose type 2 diabetes. With type 2 diabetes, your blood glucose gets too high because your body doesn't make enough insulin to move blood sugar from your bloodstream into your cells, or because your cells stop responding to insulin. Prediabetes. Prediabetes means that your blood glucose levels are higher than normal, but not high enough to diagnose as diabetes. Lifestyle changes, such as healthy eating and exercise, may help delay or prevent prediabetes from becoming type 2 diabetes. If you have diabetes or prediabetes, an A1c test can help monitor your condition and check how well you've been able to control your blood sugar levels. Why do I need an HbA1c test? You may also need an A1c test if you have symptoms of diabetes, such as feeling very thirsty, urinating, peeing a lot, losing weight without trying, feeling very hungry, blurred vision, numb or tingling hands or feet, fatigue, dry skin, sores that heal slowly, having more infections than usual. What do the results mean? A1c results tell you what percentage of your hemoglobin is coated with glucose. The percent ranges are just a guide to what is normal. What's normal for you depends on your health, age, and other factors. Ask your provider what A1c percentage is healthy for you. To diagnose diabetes or prediabetes, the percentages commonly used are normal, A1c below 5.7% prediabetes, A1c between 5.7% and 6.4% diabetes, A1c of 6.5% or higher. Providers often use more than one test to diagnose diabetes. So, if your test result was higher than normal, you may have another A1c test or a different type of diabetes test, usually either a fasting blood glucose test or an oral glucose tolerance test (OGTT). If your A1c test was done to monitor your diabetes, talk with your provider about what your test results mean.